With the death toll of the Ebola virus epidemic at well over 2,000, the World Health Organization says that the number of Ebola cases is rising faster than the health authorities' ability to contain the outbreak. This is owing greatly to increasing numbers of infected people in the three hardest hit countries, Guinea, Liberia, and Sierra Leone. Nigeria and Senegal are the other two countries affected, which have contributed to the statistic in a smaller measure. In Nigeria, there's been a significant reduction in the number of contacts under surveillance as more people complete the mandatory 21-day observation period and are certified free. On the program with me is Dr. Adeyeye Arigbabuwo, a healthcare management consultant, chairman, Association of the General and Private Medical Practitioners of Nigeria, Lagos State Branch, and Deputy National President, Healthcare Providers Association of Nigeria. You're welcome to the program, sir.
Thank you very much.
We've been doing well.
Thank you.
Lots of people are being discharged. We don't have any active case right now in the country. But is there anything we should be doing, any other thing we should be doing besides what we are doing to contain the outbreak?
Yes. I think Nigeria has been quite lucky in terms of our health system in trying to curtail this virus, as it were. And advocacy, education, environmental hygiene, universal precautions, not just because of Ebola, not just about Ebola, but at least things like hand wash, using soap, but this soap, hand wash, yeah, good. Then again, that is at the domestic level. Even at the health institutions and facilities, we also advocate the same. But in addition to that, there should be the use of gloves, for example, among health workers, as it were. And those that may be having contact with wildlife, we have really been able to educate to the extent that at least this fruit bat has been known to be the reservoir. And then those who do game, it's wild game, so to say. We've warned for now, we can go on holiday as far as possible in terms of consumption or processing of bushmeat. And again, the general hygiene, where you make sure you get your hands washed after contact with anything whatsoever manner, as many times as you can wash your hands. We should not forget that this particular virus, for example, the Ebola virus, when the temperature is about 60 degrees centigrade, for example, is no more stable. And not only that, even when you're exposed to the ordinary sunlight for a while, it's gone. Then with hand wash, by the time things like bleach or whatever is added in some level of dilution, for example.
So the virus is not as formidable as people make it out to be?
No, it isn't like that. And really, you really need to have contact with either a sufferer, a corpse that died of Ebola, or the body fluids of a sufferer. I mean, now,
I understand when you talk about personal hygiene, washing of hands and all that. But when you say keeping the environment clean, how does that come into play in this matter?
Yes. You see, don't forget that even in our environment, as it were, like we are talking about Ebola now, we're also talking of Lassa fever, for example. And we know the role that rats play in this. And again, in every filthy environment you have around you, where you dump waste, you just defecate, or let me be careful. The way we dispose of our wastes, for example, maybe fecal matter, urine, for example, we do things like that publicly at times. We do it freely, publicly, and we walk away. And like I've often said, who knows, that market woman just backing a baby, and a chin or puff just drops down in the marketplace, and she picks it up, blows off the sand or the dirt in there.
Which they do often.
Give it back to the baby. I mean, it could even just have been a product that from a place or a surface where somebody had just soiled, so to say. And packing heaps of domestic waste. Even at times, we've warned about hospital waste. And I mean, Loma in Lagos, for example, they do a wonderful job in that direction. And cleaning or cleansing our, kitchen and kitchenettes, so to say, to prevent rodents. You prevent also, as much as possible, these fruit bats that actually perch around. They perch around fruits. And don't forget, it's only among humans that we don't like to eat what our brother or sister has just finished eating part of. They don't want to eat remnants. With animals, it's not like that. Fruit that is falling, mango or whatever, falling down, it's possible that the bat are taking perch on it, and as it's landing, the monkey can pick it. Monkey doesn't or did not finish it, drops it, and then the antelope also comes around and pick it. These are these things.
Well, but we've been assured that fruit bats, those fruit bats who are the hosts of Ebola, don't live around here.
Yes, that might be true to a good extent, but don't also forget intra-border crossing of animals. I mean, you have heard stories of even birds flying as much as from Africa to Asia. And so who says that things are not possible? Anything is possible.
People say that the risk of getting EVD, that's Ebola virus disease, by travel, air travel, is very low. But we got it by air travel, so to speak, at least the person who brought it traveled in. So what's your take on that?
Yes, my take on that is very simple. Ebola virus disease is not transmitted until the patient is actually actively sick, very, very sick. And when they are sick and they're weak, that's the level where they can transmit it. And that is why you see we advocate things like temperature check at the airport, seaport, and whatever. Even they also encourage, motor park operators now, for example, to try something similar to that by getting this non-contact thermometer. We encourage institutions, we encourage schools, we encourage hotels, we encourage every public place, for example, to try as much as possible to get something like non-contact
thermometer. So are you saying
thermometer.
the hotels, for example, will check every single person who is coming into the hotel, check their temperature?
Oh, don't forget that most of them even carry this bomb detector, anti-bomb detector, that kind of a thing. So nothing prevents them from giving their security officer that non-contact thermometer. People are coming in seconds. You press like a pistol shape like the gun shape. You press and in seconds the temperature reads out, so to say. So when you move about, like you and I are here now, active and talking and discussing, I have the strength to discuss.
So we can't have
You're not
Ebola.
likely to transmit Ebola. Even if somebody is incubating or nursing it, there is a level of viremia. There's a level the virus will reach before you can transmit to another. So the other, don't touch me, don't move near me, don't use your body to touch my body. It's not just about that. An Ebola potential patient who can transmit it must really be sick, or you have history of contact. So far, what we have in Nigeria, I've been traced to one form of contact or the other with the index case, or the contact of the contact, or the contact of the contact of the contact, in whatever degree you want to look at it in an exponential way. That's what we have on ground.
So with this reasoning now, do you think the dates for the children's resumption is okay? You know, don't forget that they say we are not safe until every other country around us is safe. Is it okay for children to go back?
It is the Honorable Minister of Health in the country who is authorized to make pronouncements concerning incidences, outbreak, case surveillance, quarantine, or whatever, and then be advised, because he's number one citizen that takes custody of that.
Of health.
And pronouncement from him is actually what you call authoritative. Howbeit, if you ask of my take in this situation, as Dr. Arigbabuwo and as a family physician, I would want to observe that it is not the time that these children return back to school that matters. Even if you like, we say let them stay at home till December. To me, it is not something that you so easily say, oh, quickly, it's already eradicated. Or it's already eliminated.
So you say
we have to watch out.
Too hard and fast about the decision.
What we need to do is to concentrate on our own preventive measures and be on the lookout for possible whatever degree of contact of the contact of the contact of the contact. And again, we also look out for people who are flooding in or trickling into the country through the borders. You know, we have the sea border, we have the air border.
And unfortunately, the illegal borders.
Yeah, the legal borders are so many, and those are the ones that are having the headache, because there are well over 1,000 illegal borders that you can think of in this country today. People can walk in anyhow, anywhere. These are the tasks. And so, normally I don't like focusing on government all of the time in this situation. It is your task. It is my responsibility. When all of us know that this is a public health problem, it must everybody's task.
But with all this noise, let me put it that way, about Ebola and the symptoms and all that, even those manning the illegal borders, perhaps they won't be so pleased and so ready to let people pass through the legal borders with a very sick person.
Yes and no. Yes, because if we are all determined to make sure we get our country secured and we make the world a better place, we will do just that. We believe that they will not allow it. And no, if for any reason we allow any element of compromise, and I don't want to use corruption, and we begin to allow people, especially intra-border cops, transportation, interstate, and all of that, and you can see people are even readily making some brisk businesses with this Ebola rant. Even some politicians.
We've heard that zoonotic diseases are not just diseases that animals give human beings, but human beings also give animals. Can Ebola virus disease be transmitted from a human being to an animal?
To a human being through an animal, or to an animal to a human being?
From a sick human being to an animal.
Yes, if an animal is not infected, and for any reason or peradventure, the animal is probably like a pet, living close or living with an infected patient, for example, is actively infected, so to say. Probably it's not isolated, it's under surveillance, and maybe to the vomiters, fecal matter, or whatever, that animal can get infected. And
can that animal in turn give it to another human being?
It's not impossible. For example, children or those who still take that animal as an extra pet or second degree pet, that is the relation of the owner, the primary owner of the pet, for example. But these are just things we are looking at, that the chances are there, but not likely, because when the Ebola patient is there, really sick, it's not even likely to have an opportunity of attending to a pet or a pet moving so close, except maybe it's not isolated, it's just a domestic place, for example, and as you know, carelessly left the waste product of the body, and the animal has innocently, so to say, just gone there to perch on those things, and probably, I mean, this is a possible scenario, but then it's remote, because the tension and stress around, especially when the person is really, really sick, may not warrant a kind of trying to cuddle.
So how should materials, maybe PPEs and injections or anything that is used for drips, for example, used for an Ebola disease patient, how should they be either disposed of or sterilized?
An Ebola patient, for example, is not supposed to be taking treatment at home.
That's one.
And this is very key. Even if it's in the hospital, except designated hospital. Ordinary primary health center or health clinic or just ordinary hospital should not just sit to say, look, I want to start treating Ebola patient here. And that's why we have our isolated centers.
That means that what happened with the patient who ran off to Port Harcourt was very unprofessional.
That one was total illegal way of handling things like that. It's an illegal way. We have the Center for Disease Control, for example, in Yaba. We have some other designated centers, or maybe like where they have now usage or whatever, and then in Luton, that kind of a thing. The experts are there who are supposed to attend to this sick, and the way they dispose their waste, the sharps, the linens, the beddings, the fecal matter, the urine, are specially designed to the extent that you leave unto Caesar what belongs to Caesar. Even putting on PPEs requires some education. The fact that you're a doctor.
They put on the PPEs in pairs, isn't that right? Yeah. Somebody has to help one person to finish putting on his PPEs.
You require some training. You can't even train for less than 5 days, for example, to be able to master it very well. You could be a professor of medicine. If you are not trained in the use of PPEs, you are still an illiterate in its use. So you should just take some training.
So how really do they dispose of these things?
The first thing you do, report a suspected case. Those in surveillance and those who are the monitoring and the rumor mongers, they come around. You are not supposed to be transferring the patient up and down, even in your facility as you see it. The first duty you do after making sure you protect yourself, you isolate the patient. After isolation, immediately somebody else is already making call around to the various Ebola alert number and centers that we have this through the rumor managers and things like that. They do, and they have to come around to assist you in evacuating the patient. it is not your duty, for example, to say you want to evacuate on your own, because making such movement, there are what we call designated ambulances that will do such an assignment. And how they now handle it at the specialized center is the business of those experts that are there. Because we are not going to be saying this to the public for somebody to begin to learn to think of how to be managing an Ebola case
at home.